with school. And with school, it's been a big story for the last couple of weeks with immunization records in Seattle Public Schools. The flu, it's like ripping through our newsroom and all of our families. We've all been hit by it as well.
Yeah, so to talk more about that, of course, is Dr. Don. Thank you so much for being back.
Great
I feel like I've
you.
had the flu. Have I had the
You
flu?
sound like a little congested. I'm no doctor, but can we diagnose
What
you
does the
officially
flu
with
look like
congestion?
for real?
Well,
when people have it?
influenza-like illnesses look sometimes like a regular cold with fevers, sore throats, coughs, but the flu really, you feel like you've been hit like with a Mack truck.
Is it more like norovirus sometimes?
No, it's not that. You just feel like you can't get out of bed. You're extremely fatigued. You may have headaches, body aches. It's not just a sniffle and a little cough.
Okay.
Not just a
I
sniffle
don't
and a
have
little
the flu.
cough.
Okay.
So we didn't get Snowmageddon this year, but we may be getting Flumageddon.
Yeah.
Okay.
And people that say, well, but I don't need it's too late. I don't need the flu shot. I know you've mentioned this before, but I feel like if people are watching and have missed it, what is your, as a doctor, message to people out there?
Well, the flu is extremely high in Washington State and 32 other states. It's moderate in about 16, 17 other states. The only place that you can escape it that's minimal is New Hampshire, and nobody's going there. So the answer is that we've already had 10% of the deaths under the age of 18 in the United States right now are in our state. We've had 2 kids under the age of 4 pass away, 1 child from 5 to 17 pass away. There's been 30 pediatric deaths, and they're mostly from influenza B, which affects youngsters 0 to 4 more and over 65. Thank you very much. So the only thing that you can do in terms of protection is to get that flu shot. That's your only protection. And it's really not too late because the season is ramping up and we're seeing increased flu-like activity everywhere in the United States. You can't escape it even if you go on vacation somewhere.
Influenza B strikes young kids and seniors, you said, but what is, so there's influenza A, right? Or, I mean, can you talk about the strains a little bit, I guess, and then how the vaccine, because the vaccine has been doing well with certain strains, right?
The vaccine is usually in kids about 60 to 65% effective against influenzas. The influenza B, there's 2 strains, Victoria and Yamamoto. Most of the strains that they're finding in hospitalized patients are now B Victoria strains, which are much more likely to affect young kids and older elderly people. Okay. So the answer is that the flu vaccine has these strains, and basically that's where you want to get your protection, because if you do have the flu vaccine and you get the flu, you are much less likely to be hospitalized and very much less likely to die. Yeah. It's not perfect, but then airbags and anti-lock brakes are not perfect in cars either.
Right.
So, I guess I never really knew all that stuff about the flu.
Yeah,
you know?
and it's just a warning I know you all can't say enough. All right, so now we've got about...
it's not too late because we're only at week 40, and we can go all the way through May. And as I said before, a lot of these cases occur after January the 1st. So if you haven't gotten one, remember that it's out there and it will affect you if you're nearby.
All right, I mean, that's not too late. Now, let's quickly